like.
Well, let's bring this meeting to an official start then, as we do know that there's a lot to learn from the mayor and his experiences over the last several months facing this pandemic across the entire world. My name is Anthony Quinn. I'm the Chief Community Officer at CARP, and I'm pleased to welcome all of our participants this morning from the Barrie CARP chapter. This is the first virtual meeting of the Barrie CARP chapter, and until we're able to meet again in person, this will be the best way for us to continue to learn and share information and to continue our advocacy work that's very important to CARP members. And we're very pleased today to have Mayor Jeff Lehman join us. And I wanted to first introduce the president of the Barrie CARP chapter, Gwen Kavanagh. Gwen has been a dedicated volunteer in Barrie for, I think we're up close to a decade now, Gwen, that you've been working with the Barrie CARP chapter. So I'll give the floor to Gwen. I'll be acting as the technical director for this meeting and may interject on behalf of the national office. And I'm going to invite Gwen to introduce the mayor and the goings on of the Barrie CARP chapter. But after we hear from the mayor, we're going to open the floor up to everyone who's listening in and encourage you to ask questions using the Q&A function in the toolbar at the bottom of your screen. Indicate your question in writing or let me know that you want to ask the question in person, and we will delegate you as a panelist. You'll appear on the screen the same way that Gwen and I and the mayor do right now, and we'll hear from you in person. So without further ado, introduce you to Gwen Kavanagh, the president of the Barrie CARP chapter.
Good morning, everyone, and welcome. Thank you for joining us. As Anthony mentioned, we are trying to do some advocacy, even though we can't have our regular meetings, etc. I have joined Anthony in Zoom meetings with some of our government officials at the provincial level. And we are especially interested in the long-term care homes, of course, and all the horrible things that have happened there. Not to say that all the homes are that way, but too many is too many. And so I'm very pleased today to be able to have Jeff Lehman join us, Mayor Jeff Lehman. He was originally scheduled to speak at our May meeting, of which, of course, we had to cancel. So I'm really pleased that we were able to do something other than the regular meeting. And I'd just like to give you a little bio on the mayor. He's our 48th mayor of the city of Barrie, having been reelected for his third term in 2018 with 91% of the popular vote. From 2014 to 2017, Mayor Lehman chaired Ontario Big City Mayors Caucus, representing Ontario's 29 largest cities, and is currently vice chair. Mayor Lehman is also a founding director of Electra, the second largest community-owned utility in North America, serving more than 1 million customers in Southern Ontario. He holds a BA from Queen's University and a master's degree with first-class honors from the UK's London School of Economics. As an economist, he writes and speaks frequently on issues affecting Canada's cities. In 2019, the prestigious US business magazine Fast Company named Lehman one of its top 100 most creative people in business for his innovative solutions in government. Mayor Lehman is a passionate believer in transforming urban economies through public and private entrepreneurship, and I'm a fan.
Thank you so much. That is much too polite a bio. Remind me to write a shorter one. Can everybody hear me okay? Is the sound all right, Anthony?
Yes, sounds very good. Thank you.
Great. Okay. So what I thought I would do this morning is talk a little bit about where we are, knowing my audience is local, but where we are, of course, is in the midst of a global event, and all of our lives have been put through a tremendous amount of upheaval over the last 4 months in North America and the last 6 months in Asia and Europe, as COVID has changed virtually everything about the way we live and the way we work and how we are with one another. So I do also want to talk a little bit though about where I think we're going. And you know, one of the remarkable things about a pandemic as an event, I remember describing it early on as it's a winter, not a blizzard, by which we mean it's a season. It's going to last months. Unfortunately, it could be over a year. It's not like other types of disasters, a tornado or an ice storm or an earthquake, which is over in seconds or minutes and leaves devastation. But then you rescue people, you clean up, and you rebuild. This is a much different kind of circumstance, and it is much more challenging in many ways as a disaster, a pandemic, because it requires a literally all of society response, and it's not limited geographically, and it's very insidious. That having been said, as we sit here today in Barrie, I can say that we have a lot to be proud of in the way that as a community, we responded to COVID and the success that we've had in stopping the spread. We really stopped the spread of COVID-19 in our part of the world about a month ago, arguably 6 weeks in late May. Our numbers have been dropping significantly, and our medical officer of health would say, if he were here, and I agree, that the virus continues to exist in our community. The potential for it to circulate more broadly is always there. And as we reopen, there are specific challenges associated with that are going to require us to adapt. And I'll talk about that in a minute. But as we sit here today, we have had only one new case in Barrie in the last 8 days. That is awfully close to the magic 2 weeks without a case, which would be the marker to move to phase 3. Now, the Premier has said, unlike with phase 1 and 2, he's reluctant to do phase 3 in stages. I think we here in Barrie did have some challenges, and we're continuing to have some challenges with folks coming from the GTA to use some of our beaches and so forth. That's been a challenge for Wasaga Beach and Barrie and Innisfil and others. But part of that was because Toronto couldn't open up as quickly. Toronto, Mississauga, and Brampton have struggled more with containing COVID than other places. And if I can I'll back up now to sort of, in a way, the beginning of all this. And I'll tell you my personal story. I was in California in early March with my daughter and my parents, who go down for 6 weeks. And COVID was starting to affect Europe and was certainly an issue in Korea and China at that time. And I remember thinking to myself just before I got on the plane in Toronto, I wonder if this is going to turn into a thing in the week that I'm away. Well, that was Tuesday, March the 12th, or 11th, excuse me. For those who are tracking the history of this, Thursday, March 13th was the day that North America really woke up to COVID and everything started closing down. And what triggered that was on the Wednesday night, a couple of basketball players, NBA basketball players, tested positive for COVID, which resulted in the basketball games that they were going to play that night being canceled, which then caused the NBA, the Basketball Association, to cancel all basketball games. And all of a sudden, everybody sort of went, "Oh my gosh, this is landed." So that began, for me, a period of 4 weeks of nonstop problem solving, because in the midst of COVID, local have had to deal with many of the practical aspects, the change that we've had to make to protect one another through distancing and through closing down and we work and act and travel and everything. So back to the personal story, I booked on another flight within a day or two, and my daughter and I flew back across the States on the Saturday that COVID was starting to really impact North America and Canada, or at least the caseloads were starting to grow, and so the choices were being made to close everything down. So I had to go into self-isolation for 14 days. I've never had any symptoms of COVID, but as was proper, that's what I did. I worked from home, as we are now on Zoom. We are all learning to live through Zoom and interact through Zoom, and it is not a perfect replacement, that is for sure. You miss in many ways the subtleties of in-person contact that can't even be replicated through video, although this is a lot better than audio alone. We at the city, I declared a state of emergency in the city of Barrie about a week into COVID. That triggers our ability to move a little faster when it comes to changing laws and bylaws, and also to deploy our police and fire a little differently. And I mean, again, as I said earlier, a pandemic is less of an emergency natural disaster as a major ongoing threat to a community where, you know, it's less about lights and sirens, and much more about trying to protect people through systems, through regulations and changes. So, you know, that from the beginning of COVID, I felt that should be led by public health. And one of the big challenges in our world today is there are far too many sources of fake or false information. And it is easy to feed a conspiracy theory because of social media. And that creates a challenge for elected officials like myself, because we are, I mean, my job really in a crisis is messenger in chief. Yes, I make some decisions, I have some executive authority, but the day-to-day issues are managed by my emergency services, my CAO, the heads of the water department, the road department, and so on. And my job is to communicate them. So in doing my daily updates by video, which I post on Facebook and Twitter, and I do a daily interview with Barrie 360, which is 2 of our local radio stations. I do three interviews a week with CTV, which lately has been 1 interview a day with CTV, sometimes 2, and global news as well. And then the online sources, Barrie Today, civco.com, is so a lot of my time trying to convey the messages. And one of the huge challenges in that is, you know, what we had to ask of people as Canadians over the last 4 months was a collective effort to protect one another. And, you know, the tragedy of long-term care here, there's a number of elements to that. And I really want to speak to that because of all things that have transpired, that is the worst and most tragic, and it must be the most urgent to be fixed. I'll come back to that. What we asked of all Canadians was this collective effort. We had to try and message it as clearly as we could. So we said, stay home. It was a very simple message, stay home. And if you're sick, stay home completely. If you're not sick and you have to go out to get groceries, do it alone, you know, minimize trips, minimize travel, don't go to your cottage, don't do any of the things that we normally do. And for about two months, that was the message. Consistent, clear, all 3 levels of government, Justin Trudeau, Doug Ford, Jeff Lehman, Charles Gardner, everybody. And it worked. Just to jump to the conclusion, it worked. We said this was going to be about, at the beginning, flattening the curve. So the curve, I'm sure everybody knows this, but of course the curve is the epidemiological curve, the rise in the number of cases of the virus. We had to stop that from growing, because if it kept growing exponentially as it did in Italy and in New York City for a while and so on, it would overwhelm the healthcare system. So to allow our healthcare system to be able to treat everybody who got sick with COVID, we had to flatten and lower the number of people who were getting sick. And that meant distancing, staying home, and shutting down most of the economy and society. We saved thousands of lives by doing it. Tragically, we lost hundreds of lives in long-term care because infection protocols, working conditions, age of homes, mental age, unacceptably poor. And lest anybody think I put blame in one level of government or direction. Yes, it was a provincial responsibility, but 3 political parties for decades and allowed to get to that. Only because of how tragically dangerous that was. So the outbreaks occurred in long-term care, but by and large in the community were contained, and they were relatively modest. Now, one of the interesting things about COVID is there's a direct relationship between how dense a city is and its rate of COVID. So urban centers like Toronto and Mississauga were the highest rates. smaller centers, Northern Ontario, rural Eastern Ontario, some had no cases whatsoever, none at all. Prince Edward Island, I've forgotten the number of cases they had, but they didn't have a single death. Now, Prince Edward Island's population in total is less than the city of Barrie. So, but the point is, what we learned quickly about COVID was that space is your friend. The more space you've got, the less likely the virus is to transmit. Outdoors is your friend. There's a huge amount of concern right now about overcrowding on beaches, but the reality is there is very, very little outdoor spread of COVID-19. Very, very little. The indoor situations are the ones that are really difficult. Long-term care, farms with migrant worker dormitories, and this is why, this is before I talk about where I think we're going in the future, mandatory masks. A lot of people may sort of say, well, what's going on here? I mean, we had one in the lab now, Mr. Mayor. Charles Gardner made order to China Emergencies Act.
Jeff, sorry to interrupt you, Jeff. We're just losing your signal a little bit there. You've frozen on us and we're breaking up, but I think you're back now. So just if you could repeat the last, maybe last few lines.
Sorry about that. Is that better?
It is. You're back. Thank you.
Okay. Our medical officer of health issued an order around mandatory masks, and people may be asking, why is that necessary now with the caseload so low? The reality is, as we reopen the economy, there are going to be more indoor locations that we can go into. And what I said, and I don't know if I or not, but one of the things we COVID is it is far, far more likely to spread indoors than outdoors. Outdoors, the risk is very low. Indoors, the risk is more indoor locations open as the economy opens. The mandatory masks are being rolled out as a way to protect people and keep the spread down, as we have done over the past few weeks. So the last thing I'll say in terms of my remarks is about, I think, where we're going. Throughout COVID, at the very start of the pandemic, I created two task forces, an economic support task force and a social support task force. And that was because my greatest areas of concern were that our economy would collapse with the shutdown, and we needed to do everything we could to support the sectors that were being forced to close. Second, on the social side, I was very concerned about the impact on vulnerable populations in our community. And sadly, the one that was most vulnerable were residents of long-term care. We were also very concerned about homeless populations in shelters and individuals who were getting service for things like mental health, but could no longer get that service because of the shutdowns. Fast forward 4 months, and some of the work that's been done, we just announced the other day that we received $20,000 in funding in partnership with the federal government to buy technology for residents of seniors' homes and long-term care. We're actually giving out 162 tablets to resident long-term care facilities in Barrie, as well as smart TVs and routers to get some of the homes that aren't really wired online. And that's to help people access medical services through the tablets, help to connect families and participate in things like the webinar we're doing today. We also have started a program called Care Kitchen, which is to address food insecurity. There's a lot of concern that people would not be able to get out to the grocery store, and that with people losing their jobs and some people not being able to get support, that there would be an increase in demand happen. And, you know, I think that's a would make in general, and I stop talking soon and take questions. I think the country's response has been remarkable, perfect, and fast. And oh, can you still hear me?
We lost you again for the last 10 seconds, but you're back. Oh, no. Mr. Mayor, you are frozen on our screen. Gwen, are you seeing the same thing?
Yes, I am.
Okay, as you're resetting it there, Jeff, I think we have you back.
There we go. Well, we'll hope that holds out.
Yep, thank you.
I was just about to say, in terms of where we're going, I think it's a given that we need new models for long-term care, and not only in terms of how they operate and the business model, if you will, but even the physical form of buildings. Older long-term care facilities had a much worse outcomes in terms of the spread of the virus. Newer facilities did better, but we need to rethink even the architectural design of these facilities. It's my personal hope that some of the collective effort that we saw by Canadians to respond to COVID translates to a greater support for one another as we move out of COVID. That some of that sense of civic duty that led people to change their lives to protect one another and do the things that have been necessary will be preserved in terms of the way that people support one another in communities, the way they support charities, the way they reach out to neighbors and try and assist on community engagements. But I would also say that, some of the social supports that we've tried to develop, for example, homelessness. Barrie has about 80 to 100 chronically homeless people. Most of them have been living in a motel that was turned into an emergency shelter when COVID happened, because you can't sleep in an open dormitory or COVID will spread. We're now looking at the potential to purchase a hotel property and convert it to a permanent transitional housing shelter, which can help people exit homelessness, actually get the services they need through supportive housing, and not end up cycling through our system to the hospital and the justice system and so forth. Those kinds of changes were always possible, but COVID made us all work faster and try and problem solve. And I hope some of the solutions will be lasting ones, not just temporary ones for COVID, because many of them have the potential to do a great deal of good for our community. So I will leave it there on that hopeful note. Hopefully I don't glitch out anymore on Zoom. And I'm just delighted to have the chance to speak with you and answer any questions.
Well, thank you very much for that, Jeff. It's a almost unimaginable task to take on as a civic leader when you've gone through your first two terms and generally buoyant economy and generally healthy population to be faced with this. And congratulations to you and I think really all of our elected officials in the work that has brought us safely thus far. Definitely has shone a light on the abhorrent conditions in many of our long-term care facilities, but something that CARP and other like-minded organizations have been calling for improvements to, and hopefully this very tragic event will lead to the necessary changes. But on another more civic note, I'm going to ask Gwen to start us off with some questions and encourage those of you who are listening online to share your questions in the Q&A tab at the bottom of your screen and indicate whether you'd like me to read the question or invite you to ask the question in person. So Gwen, to you first. Thank you.
Mayor Lehman, I understand that next week masks will become mandatory in our city. Is that correct?
Yes. So our medical officer of health, Dr. Charles Gardner, has issued an order for mandatory indoor mask wearing. What that means is that organizations and businesses are responsible to ensure that anyone who comes through their doors wears a mask. There are exceptions in the order for those who have breathing challenges and which are exacerbated by a mask. It's got to be a medical reason. And then there are a few other exemptions, infants and a few others. But the responsibility under this kind of order is actually lies with the organization and the business. So they are supposed to have somebody telling you to put a mask on if you don't have one on, and they will attempt to provide them. I know that many businesses are already doing that. I went to a car dealer yesterday and they had masks and hand sanitizer at the front. You put the mask on while you went inside, and then when you walk around the lot, you don't need it. So that was, but anyway, yes. Yeah, next Monday.
Jeff, I was also very concerned about what's happening in the US. I'm afraid it might get out of control. How is that going to affect us? Are we going to be able to keep that border closed?
Yeah, we are. The problem with the border is not that you can't keep it closed for tourism for indefinitely. I mean, that's a given and probably will be as long as they continue to handle this as badly as they have. I think the Prime Minister is quite right to keep the border closed. The challenge with it is there's so much cross-border traffic associated with freight and to some extent workers. You've got essentially part of the reason that Windsor-Essex has been such an issue. I'm sure everybody on the call knows this, that's the one other area that wasn't allowed to open as quickly because of their caseload. That's because of proximity to Detroit. And you've got essential workers that are crossing the border to go to work, Canadians who work in the States, Americans who work in Canada, and they're allowed to cross. So only if they're essential workers, but they're allowed to cross. So Gwen, I think I would have been more worried about that when New York was suffering, because the interaction between New York State and Ontario is so intense economically over the Fort Erie Buffalo frontier and to a lesser extent in Eastern Ontario. We did not see a lot of spread. So whatever measures are being taken to try and keep COVID out of the freight traffic, the economic traffic that is crossing the border, seems to be working. But that Windsor thing still troubles me too. It says to me that we're not going to be able to open that border up anytime soon. And I know that's probably very disappointing for members who maybe ends to go to the States when the weather turns colder, but I'm starting to wonder whether that will happen this year. I think a lot will depend on whether or not there's a second wave here in Canada. But at the moment, probably no single jurisdiction is handling this worse than Florida.
Or Texas.
Maybe Texas.
I was also wondering, the city of Barrie has a program where seniors can delay their taxes on their homes if they
Right.
are in economic strife. Will we be able to afford to keep that up?
Well, if you're over 65 in Barrie, you can freeze your property taxes, and you have to pay the additional amount that accrues when you sell your home. But if you're over 65, anybody can do that. That wasn't COVID related. We've had that policy for some years. Currently, what we had offered over the last 4 months was deferrals of property taxes. So if you didn't pay your property taxes until the end of July, no interest, no penalty, similar to what the feds did with income taxes. We're going to have to stop doing that, though, because we can't keep that up forever. We only have one primary revenue source. Almost all of our secondary revenue sources have been badly hit by COVID. For example, public transit revenue has gone from $6 million to about $1 million. That $5 million hit we had to find by cutting, to be frank, laying off city staff. And that resulted in, parks being overgrown and not enough enforcement and other problems. So long story short, no, we can't keep it up. We're going to have people pay their property. But if you're over 65, we still have that program, as we have had for years, that allows you to freeze the amount and not pay the increases year after year until you sell your home.
May I jump in on that, Gwen? Just on finances, there was a letter from a group of mayors. I'm not certain if Barrie was part of that letter that went to the provincial government asking for immediate funding to write the budgets of the cities across Ontario, and if money was not forthcoming quickly, they would see they're calling for sharp increases to property taxes and or a reduction in services. So can you comment on just
Sure.
on what the Barrie budget is looking like and what you see
Yep.
as coming down the pipe?
Yeah, thanks for that. It's been very frustrating because what's going on is the federal and provincial governments are arguing over who should pay the check to cities and towns. and they're not getting it done. And that's very frustrating because we watch CERB get rolled out quickly, the wage subsidy get rolled out quickly, commercial rent subsidy, but workers in our sector, evidently, the federal and provincial government didn't care about. We had to lay off at the city almost 500 people. That was to try and take out and costs compensate for the amount of revenue we're losing with our rec centers closed, our senior centers closed, our transit revenue gone from down by 80% and so forth. So that support is urgently needed compared to the amounts of money that are being spent. Our ask is relatively modest, but if we don't get it, I'm quite concerned about the implications. I would tell you in Barrie, well, I know the numbers. In Barrie, we've lost $18 million in revenue. We've compensated by taking out $18 million in costs, but we can't sustain that, particularly in the summer. What we did is not staff, and then we had about 100 permanent layoffs, or at least permanent staff that were laid off. We had to bring most of those staff back to try and maintain the parks, everything from cutting lawns to bylaw enforcement around the crowded beaches and so forth. So we are going to end up in deficit. And the last thing I want to put on to people right now is a tax increase in the midst of a pandemic. So we need the support. It's modest, it's one time, and it should have got done months ago, in our opinion, as mayors. And you've heard John Tory getting increasingly strident about this, and rightly so, because his city is out 1.5 billion with a B dollars, and they're desperate for help. We're not desperate because we've been able to take out some costs, but boy, it is sure going to be desperate if we get to the end of the year without support, because then we're faced with either a huge tax increase or cutting services, and people are not going to like the services we're going to have to cut.
Well, thanks for that. Can I just follow up on that, Gwen, before I get back to you? You mentioned that in your role as mayor during a pandemic, you sort of take a back seat and you become a communicator. But where does the accountability go? And we've heard this question from chapters across the province, whereby the public health are making decisions, but there's no transparency or accountability to those. We hear the messages from the political leaders, but there's no, they seem to have a real autonomous voice, and their decisions do affect the economy and people's life.
Yeah. So I would say that the accountability still rests with elected officials, because public health is an agency of government. The board, for example, that governs the Simcoe-Muskoka District Health Unit is comprised of mayors and county councillors from across our area, and that includes from Barrie, Councillor Gary Harvey from Barrie City Council, who sits on the board. The reality of an emergency, and you're quite right to raise this issue, is decisions get made very quickly, and there often isn't time for public consultation, and sometimes there doesn't seem to be time to properly even signal that they're coming. I think the Ford government has done, by and large, a very good job with managing many aspects of the crisis other than long-term care, which was a disaster. But one of the challenges we did have is that the province would often only give us 24 hours notice before they announce something, and then people would expect us to have it up and running the next day. And whether that was optional stuff like boat launches and marinas or beaches, or more important things like the phase 2 reopening of the economy, where some businesses could open, we often had to try and do that on very short notice. So anyway, the short answer to your question is the accountability remains with elected officials, and your chapters and all residents should continue to push elected officials on anything they see that they disagree with. I mean, just because we're doing it faster does not absolve us of responsibility for those decisions. Maybe I would say it would call for a degree of greater understanding that we have to make decisions based on imperfect information and often faster than we want to.
Thanks, Jeff. Gwen, back to you.
Jeff, I'm very worried that we're actually heading into a depression, not a recession. And as you said, it's many, many months. It could even go a year or two before we get back to what we considered any kind of normal. So I'm wondering, for instance, how are we going to handle our schools? And how are we going to socialize so that seniors and others are still part of the community? What are your suggestions?
Yeah, thank you for that. It's been a real struggle. I mean, the obvious answer is doing the kinds of things we're doing right now. We're replacing in-person social gatherings with technology. The city launched something we called Senior Centers Without Walls, which is phone-based, and that was taking some of the programming that was occurring at Parkview and Allendale and turning it into one giant conference call for people to call in. Those are imperfect. And Charles, Chuck and I have talked about this a lot, Dr. Gardner, that the mental health impacts and the societal impacts of prolonged separation start to become as much of a public health issue as the risk of COVID. And one of the very difficult challenges, especially with the seniors community because of the greater vulnerability to COVID, is to balance those things. It's one thing to say, okay, young kids can now be part of groups of up to 10 and your social bubbles can grow and you can have greater contact. It's another thing to say that to folks in their 70s and 80s. And so, I mean, our thinking at the moment is that large in-person gatherings are going to wait probably many more months. That's the reality. Can we do more individual things? Can we start to have safe practices around bringing small groups together? So you may not be able to interact in that group of 40 or 50 in the photography club or the bridge club or whatever it might be. But you might be able to get together for a game because there's 4 of you. You know what I mean? I think we're trying to think about what our service delivery looks like in that kind of environment. How can you keep people safe, but actually allow at least a limited degree of in-person interaction? On the issue of the depression that you started on, I think the biggest economic threat at the moment is going to be fear and confidence. The confidence for businesses to spend money and for people to spend money. There's a natural reaction to not want to do that. And the last thing we want to do is sink the whole country further into personal debt. And the government is taking on an enormous amount of debt to try and support people. My concern is that debt is going to come back to haunt us. I mean, that bill is going to have to be paid. There's no free lunch. And I think it's going to end up either in austerity or higher taxes from the federal and provincial governments. And that will have a dampening effect on the economy. So I'm less worried about depression, Gwen, because many sectors of our economy were able to continue during COVID. Fact and large wasn't affected. Construction it was. I don't know about those on this call, but my spending dropped, my personal budgeting.
So Jeff, we've just frozen there. The last thing I heard from you, Jeff, was about your personal spending, but it looks like you're frozen on us again, and you're back. Okay.
There we go. I'll just conclude by saying my personal spending dropped dramatically during COVID, and I don't mind that too much. I think probably it needed to, but that has real impacts on the economy when 30 million people who were spending whatever they were before COVID stopped spending at all. So we'll see how it comes back. I think we'll face a recession, not a depression.
Thank you. I wanted to let you know that we are taking questions from the participants, and Catherine Parent has indicated she had a question or two, so I want to unmute and welcome Catherine. You can ask a question. Thank you.
Hi, everybody. Thanks very much. Thanks, Mayor Jeff Lehman, for being here. I actually wasn't expecting to be on screen. So, okay, so one of the things that I have a concern about is, so as a community, how are we going to address the health of our loved ones that are in long-term care, but even the bigger picture as a community, isolation is really difficult. And we were talking a little bit there about depression. But, you know, as a community, we've been allowing lineups outside of big stores. We've been allowing protests. We've been allowing just, I guess when you're talking about shopping, everybody can go out and shop, but yet we can't gather for a funeral. We can't gather as a family to surround our loved ones if they're dying. I'm just wondering, are we as a community able to address health besides finding a vaccine, a medication, and putting on a mask? There has to be a more encompassing, holistic approach or a naturopathic approach or something to help people to not feel so isolated and to be able to participate in life, you know, to live life.
Yeah. Well, and I think, so the phase 2 reopening, of course, now you can gather up to 10. Your social bubble can be 10 who you can hug and touch and be part of, as long as you're all in agreement. The funerals you are allowed to gather larger groups for funerals now. And there is finally the ability to go in and see your loved ones in long-term care. You have to get tested first, but all of those things are now possible. And I think it's been a very, very difficult period of time where we couldn't do those things, and nothing hurt more. Apparently the premier was reduced to tears seeing the pictures of families, you know, trying to touch their loved ones through a window, right? I mean, it's horrible. It's absolutely horrible.
Yeah.
The reality, though, was the outbreaks killed hundreds of residents of those homes. And so in some ways, you know, obviously the restrictions weren't even strong enough. So I think the go forward, Catherine, I think we in our community are in a very good position. As I said at the start of the call, 1 case in the last 8 days. That likely means we'll enter phase 3 some point in the next, 3 to 4 weeks, which is a much broader reopening as well. There's only 4 phases. That's almost back to normal. But what Charles Gardner says, Chuck says, and I've been trying to listen to the doctors and the scientists all the way along in this, we have to learn to live with the virus in our world until there's a vaccine. There is no other end game. There's no other, even the treatments, unfortunately, I've forgotten it's Reflaxin, reduce the number of deaths in severe cases, but doesn't prevent COVID. You can't just take it if you get COVID and it cures COVID. It helps prevent people who have severe COVID from dying from it, but it only helps a third of them. So until there might be a more effective and sweeping treatment, but it's much more likely that one of the vaccines gets done first. And if I can say a hopeful note on that, the Oxford University vaccine and then the Canadian one is second in the race right now. Both are tracking to late fall to be available. So we're all sort of looking at this going, okay, if they can get that done in 4 or 5 months, that's what we need to look at. How can we keep people safe for that length of time and not have a second wave that results in more deaths, while still loosening up and allowing the kind of connections that you're talking about? And I think at the moment that's going to be possible. It's just if we don't do some of the other things, like the other thing we learned about COVID, and the last thing I'll say on this is indoor transmission is much more likely and serious. Outdoor, it's very, very hard to get COVID. So you mentioned the protests. They were 5 weeks ago. There has not been a documented case of spread from the protests anywhere in Canada. I don't know about the States, but I don't believe I've seen that there either.
No, and that's true.
And they were outside. They were outside. That's the short answer.
That's why I think it's so important to get our seniors outside, to get some activity, to do those things, because we didn't see that. And but thank you very much. And I do have to say, my dad is in long-term care. They've had no cases of COVID in Barrie. They run teleconferences. We visit through plexiglass. So we don't have to be tested because they have put a wall up for us, but we're very blessed. And I just hope many families are blessed as we have been. So,
thank you very much, Catherine, for your contribution. There is a lot of advocacy right across the country on behalf of long-term care residents and increasing their access, the institutionalization and the paternalism that the system has placed on the residents, while it is intended for their health and the health of the employees of the long-term care, may have crossed the line on their rights, and there's a lot of activity trying to bring the rights of the patients, the residents, to the forefront. So thank you very much for that. I had a question from Janet Gage. I'm going to ask Janet if she could unmute her mic and ask the question. Janet, are you there?
I'm here.
We can hear you. Go ahead, please.
Okay, I'm just wondering, for those people with compromised COPD or asthma, do you need to have a doctor's note to be exempt from wearing a mask? Will you be asked that when you go to a grocery store or into a enclosed space?
Yeah, no, I don't believe you'll be asked for a doctor's note. I think there's going to be a degree of trust that people who claim have a medical condition are telling the truth, and unfortunately, there will be some anti-maskers, as they're called, who probably don't tell the truth about that. The way the order was written by Dr. Gardner, the business is required to make best efforts, which means they are to tell you at the door that you must wear a mask. But if you don't, they are not responsible for the fact that you are claiming to have an exemption. They don't have to verify it. So no is the short answer.
Thanks for that, Mr. Mayor. A follow-up would be, we wanted to ensure that seniors in general who can't get to the doctors for a note or have some sort of proof, that there is not a discrimination in that if they are going shopping or trying to get out into the community, that because they don't have a mask, they won't be refused service. So we want to ensure that the vendors themselves are not using the mask as even unintentionally discriminating against seniors.
That's an interesting point. I think the stores that I've been in, I've been wearing a mask for a month now, in the grocery store, the LCBO, wherever. And I'm concerned a little bit about the same thing. I mean, there is mask shaming that is going on. The flip side is there are some people who have no justifiable reason to not wear one. And if you do that, you're putting everyone else at risk on purpose. And you are violating a law. So if you have a medical reason, absolutely. The order was written that way so that anybody who has coped or any other respiratory condition that a mask will exacerbate, you do not have to wear a mask. But the whole point is to protect particularly the elderly population, particularly in those indoor spaces.
And just one more question, thank you, about masks. Question from John. He was asking if mandatory mask wearing applies to apartments and condos. So will someone have to wear a mask entering and exiting their shared dwellings?
Yeah, I actually don't know the answer to that. I saw that question about an hour ago from someone else on my email. So we're compiling this morning's list of clarifications from the health unit. And I wish I could answer that for you right now, but I can't.
Thanks. Gwen, back to you while I pull up another question from an attendee.
Yes, I'm just wondering about housing, and congratulations on the homeless and housing them. That's great. That was a great concern of mine. But are you going to be changing any zoning laws or whatever, Jeff, to accommodate some of the people who are going to be losing their houses, who might need lower income housing, et cetera?
Oh, well, I mean, the remarkable thing that's happening right now is house prices in Barrie are going up, and not by a little amount. They're going up a lot. I was just talking with my girlfriend about this just this morning. I think are seeing out-migration from the GTA. I think we're seeing people who have money from Toronto, and it's higher-end homes that are the hottest commodities, which is bizarre. So rather than the sort of what we all expected, which was a sort of property market crash because who would buy a house during a pandemic, we're seeing the opposite locally. So the real challenge that creates is it worsens the affordable housing situation in Barrie. So what we're going to try and do is 3 immediate projects. One is the motel conversion. The second is actually a modular project similar to Toronto's. And the third is a social housing project that's being planned between one of our large churches and a social housing provider. There are also market affordable and supportive housing units coming from other providers like the Coral Living Center on Bayfield, who are in for site plan at the city. So there's a lot of supply coming, but until it's built, it won't affect prices in the market. So I'm in a hurry. I'm hoping that COVID and our speeded up processes associated with COVID are going to help us get some of these done faster.
In the annexation in Innisfil, was there any was land set aside for lower housing? Like how did that work, that plan?
Yeah, we're requiring the annexed land subdivisions to have 10% affordable housing. A lot of that is taking the form of townhouses, row houses, and stacked, but some is mid-rise apartment. It's not social housing, it's just affordable, which is lower cost market housing. That's only part of the solution, of course. That doesn't help a homeless person. A homeless person needs a transitional housing or supportive housing unit at $400 a month that they can pay for out of their social supports. But for all the families and lower income families or households out there, that's part of the solution.
And for these houses that are being built, are there rules about accessibility? Like the door is going to be wide enough to accommodate wheelchairs, etc.
Yeah, this not enough. There's a growing push for that in the building code and in planning. In my opinion, not enough. It's also stuff like front steps, right? If you build a home with front stairs, you're making it automatically inaccessible to anybody who needs assistance. So we're pushing for more of that, especially in the multi-unit, the townhouses and the apartments. I hate to say this, I do have a 10:30. I'm going to have to drop off in a minute or two. I just wanted to make sure if there was another question or two that you wanted me to get to, then I'm able to.
No, thank you very much for your time, Mr. Mayor. I think the only question I wanted to ask, and I'm here living in the Halton region, does Barrie or the Simcoe area have ownership or management of long-term care in your region as they do in other cities?
So our long-term care provider is the County of Simcoe. It's a bit weird, but the City of Barrie is a separated city, but we contract with the county to provide long-term care. There are 4 facilities, county-run facilities. Very fortunate that we did not have a case. There was a worker in one just last week that tested positive, but fortunately that it never got into the populations in the county-run homes.
So just to all the people online, and you'll be hearing more from Gwen in the chapter, but long-term care has obviously become the focus of our advocacy for the next foreseeable future. So the mayor and the region, along with the provincial bodies and the federal government, will be hearing from CARP and our 320,000 members across the country. And the light has never shone so brightly on seniors' issues. And we just ask that in all the decisions that you're coming across, that you do keep seniors look through that lens of what their needs are when it comes to housing and to the care of our most vulnerable. So thank you very much, Mr. Mayor. And I'll just go to Gwen to thank you again.
Yes, Jeff, as always, you've been very accommodative and we really appreciate it. And I'm glad you're our mayor. Thank you.
Oh, thank you very much. Thanks, Gwen.
Thank you, Mr. Mayor. Thank you to all the participants. This brings an end our first virtual meeting, and thank you to everyone who joined and listened in. We'll be sharing this across the region with all of our members, and thanks again for your time, Mr. Lehman. Good day.
Okay. Bye-bye.
Bye, Jeff.